Not through a blood test, not through a formal diagnosis delivered across a physician's desk, through signals that have been present for months, sometimes years, in a place most people never think to look with any real attention: your feet. Before any laboratory result confirms elevated blood sugar, before any physician writes the word diabetic in your chart, your body initiates a warning process that is visible, specific, and almost universally misread. The tingling that gets attributed to sitting too long, the cracking heels that get blamed on dry winter air, the wound that is taking longer than it should to close. Each of these has an explanation that most people never receive because the appointment that might have provided it was 12 minutes long and focused on the numbers already in the chart rather than the signals already on the body. Today, I am going to change that. My name is Dr. Reina Sato. I am a preventive medicine physician and longevity researcher, and the early recognition of blood sugar dysregulation through physical signs that precede laboratory diagnosis is an area where the gap between what patients are told and what their bodies are already communicating is wider than it should be. The patients I have seen catch this earliest and manage it most effectively are the ones who understood what their body was showing them before the blood work confirmed it. That understanding is what today is about. Before we continue, one essential clinical note. Everything I am describing today is educational information about the physical signs associated with blood sugar dysregulation and the conditions that accompany it. None of it replaces clinical evaluation. If you recognize any of the signs I described today in yourself, the appropriate response is to schedule an appointment with your physician and ask specifically about blood glucose testing, not to self-diagnose or make changes to any existing medications. The information here is designed to prompt you to have the right conversation with your doctor sooner rather than later. Now, why the feet specifically, and why they speak before the blood work does. Your feet are the furthest point in your body from your heart. They are the last destination on the longest circulatory route your body maintains. When blood sugar begins causing damage, it does so gradually and at the periphery first, in the smallest blood vessels and the longest nerve pathways, both of which are concentrated in the feet and lower legs. By the time blood sugar has been elevated long enough to produce changes that are visible and feelable in the feet, it has typically been elevated for months to years. This is not a late finding. It is an early finding that has been consistently misread. The American Diabetes Association estimates that 1 in 5 Americans with diabetes does not know they have it. That is more than 8 million people with a condition that is already damaging their nerves, their kidneys, their vision, and the small blood vessels in their feet without any awareness that anything is wrong. Here are the 9 signs, what most people assume each one means, what is actually happening inside the body, and what to do about each one. The first sign is tingling, numbness, or the persistent pins and needles sensation in the feet. Almost everyone who describes this to a physician explains it the same way. My foot just falls asleep sometimes. I was sitting with my legs crossed, and occasional positional numbness from pressure on a nerve is exactly that, occasional and positional. It resolves when you change position and does not return without a clear mechanical cause. The sign worth attention is different. It is recurring, it appears without a clear positional explanation, and it persists or returns regularly. What is happening at the biological level is this. Chronically elevated blood sugar damages the myelin sheath, the protective coating that surrounds nerve fibers and allows electrical signals to travel cleanly from the brain to the extremities and back. Think of a nerve fiber as an electrical wire inside a plastic coating. The coating is what allows the signal to travel without interference. When blood sugar remains elevated over months and years, it degrades that coating progressively. The signal begins to distort. The distortion is experienced as tingling, numbness, or the intermittent sensation that the foot has gone to sleep without a mechanical reason for it. This condition is called peripheral neuropathy. The American Diabetes Association identifies it as the most common complication of diabetes, affecting nearly 50% of people with the condition, and it almost always begins in the feet. The practical response begins tonight. A 20 to 30-minute walk daily is the single most accessible intervention for maintaining circulation and protecting the nerve endings in the feet. Movement drives blood flow to the peripheral vessels that nourish those nerve fibers. Begin reducing added sugar in your daily diet now, not gradually, and not eventually. The damage peripheral neuropathy produces is cumulative and partially irreversible. Earlier is always better. The second sign is burning in the soles of the feet, particularly at night. During the day, the sensation is manageable. There are distractions. But at night, when there is nothing else to focus on, many people describe lying in bed with feet that feel as though they are on fire, unable to find a comfortable position, unable to sleep through the discomfort. The explanation most people give themselves is that they were on their feet all day, or the summer heat, or circulation that has always been poor. What is actually happening is a specific consequence of nerve damage that is distinct from the numbness described above. When certain nerve fibers are damaged by chronically elevated blood sugar, they do not simply go quiet. They become dysregulated. They begin generating signals independently of any actual external stimulus. The nerve sends a heat message to the brain. The brain receives it and registers burning, but nothing hot is touching the foot. The nerve itself is the source of the signal, not any external condition. Research published in Diabetes Care identified burning foot pain as one of the first reported symptoms in patients who were later formally diagnosed with type 2 diabetes, often appearing 1 to 3 years before the diagnosis was made. This is not a late complication. This is an early warning that is being experienced as a nuisance, rather than recognized as a signal. 2 practical responses for this sign. Adequate hydration, a minimum of 8 glasses of water daily, supports kidney function in clearing excess glucose and maintains the tissue environment that nerve health depends on. Increasing dietary fiber through vegetables, legumes, and oats at every meal slows the absorption of glucose from food into the bloodstream, reducing the chronic glucose elevation that is producing the nerve damage. The third sign is a wound on the foot that is not healing at the rate it should. This is the sign I want every woman reading today to understand most clearly, because it is the one with the most serious potential consequences if it is not recognized for what it is. A small blister from a shoe, a minor cut, a scrape on the heel. In a body with normal blood sugar and normal circulation, these heal within days. When blood sugar has been chronically elevated, healing slows in ways that are not immediately obvious, but are clinically significant. The mechanism is vascular. Chronically elevated blood sugar causes the walls of small blood vessels to thicken and stiffen. The tiny vessels that supply the skin and superficial tissue of the feet are among the first affected. When a wound occurs, the biological materials required for repair, oxygen, white blood cells, clotting factors, tissue-building nutrients must travel through those damaged vessels to reach the wound site. When the vessels are narrowed and stiff, delivery is compromised. The wound site receives less of what it needs to heal. The wound remains open longer than it should. An open wound that remains unhealed is an entry point for infection. In a foot with compromised circulation and impaired immune response from chronically elevated blood sugar, that infection can progress with a speed that is disproportionate to the original size of the wound. The Centers for Disease Control reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputation in the United States, with over 100,000 occurring annually. Almost all were preceded by a small wound that was not recognized as requiring prompt attention. The practical response is this. After your bath or shower tonight, sit down with adequate light and examine both feet completely. Look between every toe. Look at the heel and the sole. If you find any wound, clean it with mild soap and water, apply an antiseptic, and cover it. If it has not improved meaningfully within 48 hours, contact your physician, not at your next scheduled appointment. Within 48 hours, the fourth sign is skin discoloration around the ankles and lower legs. Patients describe it in different ways. A darkening, a reddish or dusky tone, a bluish tint to the skin around the ankles that was not there before. Most attribute it to sun damage or to the natural variation in their skin tone. There is a specific pattern of discoloration associated with compromised peripheral circulation that is worth knowing. When the small blood vessels supplying the lower legs and feet are damaged by chronically elevated blood sugar, the skin in those regions receives less oxygenated blood. The change in oxygen delivery changes the color and quality of the tissue. The skin may darken, develop a reddish or bluish tone depending on the degree of deoxygenation, and become thinner and more fragile as the tissue is progressively undernourished. A study published in the Journal of the American Academy of Dermatology found that these skin changes are detectable an average of 18 months before a formal diabetes diagnosis. This is among the earliest visible signs available, and it is sitting in plain sight. The practical response involves 5 minutes of ankle circles, toe raises, and calf stretches every morning. Even small movements drive blood flow into the peripheral vessels of the lower legs and feet. If sustained movement is not currently possible, elevating the feet slightly while seated helps return blood from the periphery toward the central circulation. The fifth sign is cracked heels that do not respond to moisturizer. Cracked heels in winter are common enough that most people dismiss them entirely. The sign worth attention is different. Cracking that occurs in warmer months, or cracking that persists and deepens despite consistent application of moisturizer, has a different underlying cause than seasonal dryness. Your skin's natural moisture production is regulated in part by the autonomic nervous system, the branch of the nervous system that controls automatic functions that happen without conscious effort. When the autonomic nerves are damaged by chronically elevated blood sugar, the sweat glands in the feet receive impaired signaling and reduce their output. The skin of the foot loses its internal moisture source. External moisturizer addresses the surface, but cannot replace what the sweat glands are no longer providing. The resulting cracks are not a cosmetic issue. They are breaks in the skin barrier. In a foot with compromised circulation and impaired immune response, breaks in the skin barrier are infection entry points with the same serious potential as the wounds described above. The American Podiatric Medical Association identifies chronic treatment-resistant heel cracking as a significant indicator of autonomic neuropathy, a condition directly linked to long-term elevated blood sugar. Moisturize both feet thoroughly every night before bed, paying specific attention to the sole and heel. Pure coconut oil or a thick urea-based cream works well. Do not apply moisturizer between the toes. Trapped moisture in that environment promotes fungal growth. And maintain adequate fluid intake daily because skin requires hydration from the inside as much as the outside. I want to tell you about a patient I will call Helen. 69 years old, she came to see me about fatigue that she had been attributing to disrupted sleep. During a complete physical assessment, I asked her about her feet. She mentioned that her heels had been cracking badly for about 2 years, despite consistent use of lotion, that her feet sometimes felt like they were burning at night, and that she had noticed some numbness in her toes that she had assumed was related to her shoes. She had 3 of the 9 signs I am describing today. Her fasting blood sugar came back at 198. She had been living with undiagnosed type 2 diabetes for an estimated 18 months to 2 years based on her HbA1c. What stayed with me from that appointment was not the number. It was that she had been applying lotion to her heels for 2 years, every night, and it had never occurred to anyone, including her previous physicians, to ask whether the cracking was responding to treatment. It was not responding because the cause was not dryness. The cause was autonomic nerve damage from chronically elevated blood sugar, and lotion cannot address that cause. The 6th sign is consistent swelling in the feet and ankles that leaves visible marks from socks by the end of the day. Occasional swelling from prolonged standing or sitting in warm weather is common and typically resolves with rest and elevation. The sign worth attention is different. It is persistent, it is present most evenings regardless of activity level, and it leaves indentations in the skin from sock elastic that take longer than expected to resolve. When blood sugar has been chronically elevated, it damages the small filtering structures of the kidneys over time. The kidneys regulate the body's fluid balance. When that regulatory capacity is compromised, fluid accumulates in the lowest point of the body by gravity, which is the feet and ankles. The National Kidney Foundation reports that diabetic kidney disease affects approximately 1 in 3 adults with diabetes, and lower extremity swelling is frequently the first visible sign that kidney filtration is under strain. When resting, elevate your feet above the level of your heart using a pillow or folded blanket. This assists fluid return from the periphery toward the central circulation. Reduce dietary sodium, because sodium causes fluid retention that worsens edema significantly. Read labels carefully, as processed and canned foods contain levels of sodium that are not apparent from taste alone. If swelling is new, worsening, or accompanied by any shortness of breath, bring it to your physician's attention promptly. The seventh sign is sharp, stabbing, or electric pain in the feet, particularly at night, that has been attributed to arthritis or an old injury. This is the sign most commonly masked by over-the-counter pain medication for months or years before its actual origin is identified. The pain is real. The cause is not what is being treated. When certain nerve fibers are damaged by chronically elevated blood sugar, they do not become less active. They become erratically hyperactive, generating intense, unpredictable pain signals that the brain receives as stabbing, electric, or burning pain. The pain appears without any mechanical injury or external cause. It is the nerve itself, damaged and dysregulated, firing alarm signals that do not correspond to any actual tissue damage. Taking ibuprofen or naproxen for this pain manages the symptom intermittently, but does nothing to address the nerve damage producing it. The signal that the nerve is generating is a request for help. Masking it delays recognition of its source. Research published in the New England Journal of Medicine found that painful diabetic neuropathy affects approximately 25% of people with diabetes and is frequently misidentified as arthritis, tendinitis, or age-related joint degeneration for extended periods before its true cause is recognized. 5 minutes of gentle foot and ankle movement before getting out of bed each morning helps initiate circulation before the feet bear weight. Flex the feet, circle the ankles, gently pull the toes back toward the shin. A gentle massage of the sole and ankle before sleep supports circulation in the hours when this pain is most likely to occur. The eighth sign is feet that remain persistently cold, regardless of ambient temperature. Cold feet in cold weather are a normal circulatory response. The sign worth attention is cold feet in summer, cold feet under multiple blankets, cold feet when the rest of the body feels warm. Persistent coldness that is not explained by the environmental temperature. When blood sugar damages the walls of peripheral blood vessels over time, those vessels become narrowed and less elastic. Their capacity to deliver warm, oxygenated blood to the feet is reduced. The result is extremities that receive insufficient blood flow to maintain normal temperature, regardless of how warm the surrounding environment is. The American Heart Association identifies peripheral artery disease caused by narrowed peripheral blood vessels as affecting over 8 million Americans, with diabetes being the single largest risk factor. Persistently cold feet, independent of ambient temperature, are one of its most consistent early symptoms. A 30-minute brisk walk daily is the most evidence-supported response to early peripheral vascular compromise. Walking drives blood flow actively into the peripheral vessels of the lower legs and feet and supports vascular wall health over time. Begin with 10 minutes if 30 is not immediately achievable. The direction is what matters initially. Start today rather than planning to start later. The ninth sign is hair loss on the lower legs and the tops of the feet. This is the sign that is almost never discussed and almost never noticed without being specifically prompted to look for it. It is quiet, gradual, and visible only when you know to look. Hair follicles require a consistent supply of oxygenated blood to maintain their function. When peripheral circulation is significantly compromised by long-standing elevated blood sugar, the follicles in the lower legs and feet receive progressively less of what they need. Over time, they reduce and eventually stop producing hair. The result is a visible absence of hair in the region supplied by the damaged peripheral vessels. Research published in Diabetes, Obesity, and Metabolism found that hair loss on the lower extremities correlates significantly with peripheral vascular disease in diabetic patients and is a reliable indicator that physicians specifically examine for during diabetic foot assessment. It is almost never self-reported because almost no one notices it without being directed to look. After finishing this today, look at your lower legs and the tops of your feet. Compare the hair density there to the density on your upper legs. If the lower legs and feet show significantly reduced or absent hair growth, schedule a blood glucose test this week. Not this month. This week. A fasting blood glucose test costs approximately $12 and is covered by Medicare for the majority of women in this age group. $12 and a single appointment can provide information that changes the entire trajectory of what follows. Here is the practical framework I want you to take from today. Tonight, before you go to sleep, sit down with adequate lighting and give your feet 30 seconds of real attention. Look at the skin, look between the toes, look at the lower legs, feel for numbness or changes in sensation. Check for any wound that is present and not healing as it should. If you recognize any of the 9 signs described today, contact your physician and ask specifically about blood glucose testing and HbA1c measurement. Do not describe your concern as a foot problem. Describe it as a concern about blood sugar, and mention specifically which signs you have noticed. That framing will direct the conversation to where it needs to go. The signs I have described today do not require a laboratory to be visible. They require attention and the information to interpret what you are seeing. Your body has been communicating. Today you have the framework to understand what it has been saying. I am Dr. Reina Sato. If this gave you information that a standard clinical appointment has not had time to provide, share it with someone you love who may have noticed these signs without understanding what they mean. Early recognition is not a minor advantage in blood sugar management. It is everything. I will see you in the next one.